Hello, I'm Dr. Dennis McKenna. I'm joined today by Chris Couchet. Chris, great to have you here again.
Thank you, Dennis.
Chris is our Senior Vice President, Chief Information Officer. Today is Monday, March 18th, giving you the update from Albany Med. And Chris, we're going to talk about a bunch of things today. We're going to talk about some updates from the college. Okay, we're going to talk some IT, obviously, very important topic for you. Workforce challenge, and then a little bit on match day as well.
Great.
So, Chris, let's begin in the college. Have a couple of important announcements to make. First of all, on the intranet, there's an article there about Dr. Badr Meen. He's a urologist here. And we've talked about this many times. We're an academic medical center, clinical care, education, research. One of the very important parts of what we do is research, and Dr. Meen is a urologist. And I encourage you to go online and read about an important research article that he did related to surgery and prostate cancer. Very impressive. In addition to that, we'd also like to congratulate Dr. Daryl Dorizio, who has now been named the permanent full-time chair of the Department of Neurosurgery.
That's great.
You've been here as long as I have, Chris.
Yep.
You know Dr. Dorizio for a long time, right? He's been serving in that interim role. That's the role that Dr. Boulos had before he moved up to become the dean of the medical college. And so Dr. Dorizio has been doing a wonderful job there, and we congratulate him as well.
That's great.
Very good. All right, let's jump over. Let's talk about Pillars of Nursing. Pillars of Nursing. So every year we time with Nurses Week, some celebrations, some recognitions, some events related to nursing. The capstone of that really is the recognition of the Pillars of Nursing. We usually have about a half dozen, and these are individuals where staff have recognized staff. So they submit nurses to be recognized, and they come from all different departments in the hospital. It's a special event. I know you're familiar with that event, and it's really a great recognition of our nursing staff.
Best recognition you can get is from peers, so I think that's awesome.
It's a beautiful way to say it, right? And of course, pillars, right? The iconography of the medical centers are pillars out front, both physically holding up the building and then inside holding up the building as well. So Pillars of Nursing, we recommend and we encourage you to submit nominations for Pillars of Nursing. The date is by March 25th. So if you could get those in by March 25th, that'd be wonderful. Again, staff recognizing staff. And of course, we'll announce who those winners are in that recognition when we get closer.
Great.
All right, let's flip the script. Let's talk about IT. First topic, Chris. A lot in the news about Change Healthcare. And as we know, there was a breach in that. And you can describe what that means. Importantly, Chris, as our Chief Information Officer, cybersecurity falls under your department. You have spoken, I think, very strongly about the importance of a strong cybersecurity and all the different processes we've put in over the last many years with your team to make sure that we protect our environment, our PHI, our PII. First of all, talk about the steps maybe at a high level that we've done to protect our data.
Sure. I think if you talk to anybody in cybersecurity, they're going to talk about defense in depth or layers of security. So we have put in place not only technology but process. Certainly we as employees are key to that process at every layer of the medical center and every layer of the system. So at the boundaries of the internet, with email, with your desktops or your laptops. Right. And those are all important aspects of the security program that we can do from a technical perspective.
Talk about two-factor authentication.
Probably the most important technology that we've put in place so far. We call that's the Gemalto, or that extra 6 numbers that you're putting in every time you log in, especially from a remote access site or getting to a web-based type of resource for us. It's absolutely key, because without that 6-digit code, the criminal cannot get at your account, and that's why that is so important.
Talk a couple times a year, at least 4 or 5, I send emails to you or to Kevin Reedy saying, is this a real email? Am I being phished? And sometimes you'll write back and say, that's a safe email. Other times you'll say, good catch. Why do I bring that up? Because we encourage our workforce to be vigilant, and if they have any questions, send it to you and your team, and you guys will look into it, right?
Absolutely. We obviously have a lot of technology around that, but the latest statistic that they've put out for the U.S. is that in almost 94% of the breaches that have occurred in America, it includes email. Yeah. It includes phishing, it includes some type of email scam where a criminal is trying to entice you to give away your information so that they can access your account.
Well, I think you and your team do a wonderful job. So talk about Change Healthcare. People may have heard about it. They may say, did Albany Med get affected? Did any of our data get breached? What's the answer?
So Change Healthcare is an organization that has a lot of different places within healthcare. Probably the one that's most impactful is about 80% of all of the pharmaceutical, the pharmacy prescriptions in the country are handled by Change Healthcare. So when they were breached about 3 or 4 weeks ago, it took down a lot of that background infrastructure. So people like us, including Albany Med, including all the system hospitals, have been impacted in one way or the other. It will be the largest breach in healthcare in the country in history. And the reason that it's important is that it just is a good reminder for all of us, all of our workforce across the system to be vigilant, to follow the processes that have been put in place, to respect the technologies that have been put in place. Don't try to end around things. And again, as Dennis says, if you have a question, if you have a concern, please raise your hand and let us know, and we'll help out.
And as soon as this came to our attention, we immediately shut off any access to or connections with Change Healthcare.
We did, and in fact, this couldn't have happened at I guess, worse time. We were a week from going live with Epic, and there was some real concern around whether any of these Change Healthcare organizations would impact the Epic Go Live. I'll just say that we resolved any of those issues right before go live, and we've not had a problem with them since. So we were fortunate in that respect. Not all of our peers throughout the country are that fortunate.
Okay. So remain vigilant. If any questions, reach out to the team. So you said the word Epic. We've been talking about that a lot lately. 2 weeks ago with Dr. Mouzakis, last week with Fran. Obviously, everyone watching at Albany Med knows we're live with that. And obviously, we look to have you give us an update where we're at. Let's start, first of all, what's your general impression about how the Go Live has gone?
So again, Dennis mentioned I've been here for a while. This is my 31st year at Albany Med. I've seen all of the technologies that have been put in place during that. I was the fortunate or unfortunate person that put in Sorian way back when, and Allscripts and all those other applications. And I'll just say that, I think from the perspective of our lens that we were looking at this has probably been the most successful implementation that we've had. We were expecting many more issues. We were expecting many more workflow problems, many more technical issues, and I think all the numbers have been much, much lower than we ever expected. I think if you were to ask Epic, you would ask our partners Nordic, Chartis, they would tell you the same thing, that this has been an extremely smooth go live. Now, we do have issues. There are issues that we find every day, and if you're impacted by those issues, it's the most important thing to you at that time, and we understand that.
So let's talk about that. So for the end user who's having some difficulty, whether it be a security issue or some workflow issue, they can elevate that, right? And you guys are working those tickets, and we know that over 3/4 of those get processed and addressed within the 24 hours. Just let everybody know what that process is looking like.
Sure. So if you have an issue, again, if you're a clinician on the floor, look to that at the elbow support, that super user, and they can enter a ticket on your behalf. They can get that ticket that'll route right into our Epic Command Center, where we have people from Epic, we have people from Albany Med that have been trained to handle those specific issues. If for some reason you don't have that access to somebody on the floor, you can dial 25000, our normal help desk number, and that will give you a choice of where to route that. You hit 1, that goes to Epic, our Epic Command Center again, and they will handle your call at that point.
All right, 262-5000 or internally 25000.
Correct.
All right, Chris, top 10 at 1, just so people know, so all the bigger issues get elevated 7 days a week, the executive team looking at these things, just again reassuring that this is the highest priority to make sure not only have we put it in, but we're going to stabilize it before we optimize it.
That's right. And I think the positive note out of there is that we're not seeing the same top 10 every single day.
Right.
Those are changing, and that means that we're solving those problems, which I think is key to making sure that we hit stabilization.
And before we hit the last two topics, are there some data points you'd like to share, objectively measuring how we're doing?
These are some of the numbers that we as employees don't typically hear unless you're on the back end of IT.
But they're impressive.
They are very impressive. And I want to start off with the soft go live. So the soft go live happened about 3 weeks ago, where we did all that initial conversion, especially in the rev cycle area. 152,000 appointments were converted that weekend over into Epic. That's just a huge number of appointments that were converted over. And there's a lot more data behind that. But why is this important? So we have this application called MyChart.
Right.
MyChart is the new patient portal. It took over Follow My Health. And just to give you some numbers and why Epic is so impactful, over 29,000 of our patients have already signed up for MyChart. 29,000.
I have. It's great.
We're hitting about 1,000 to 1,500 new registrations every single day. That's amazing. MyChart logins in the last 2 weeks, over 100,000 logins by our patients. That's amazing. And why is that important that they have access to MyChart? 99% of all of the results that are done at a clinic are in the MyChart application within 5 minutes. 5 minutes, that's amazing.
Of them being resulted.
Of them being resulted,
Yeah.
5 minutes. So in other words, if you're a patient and you have access to MyChart, you're going to see your results very quickly, quicker than we've ever been able to get them out there. Some other numbers: MyChart video visits. We've had almost 450 of them already.
Awesome.
So that's that innate functionality that we've never had
Telemedicine.
before. Telemedicine right inside of the MyChart application. And then just as a side note, Epic brings a lot of things, including secure chat. So we now have the ability for our patients to chat in SMS and text, secure texting to our physicians.
Right.
They can also email. And we also have the ability for our physicians to chat back and forth to each other if they need so. Just a couple other numbers. Every day in Epic, we are already getting, at any given time, 2,700 of our employees logged in and using Epic at one time, at any given time around the clock. It's pretty impressive. We have another function that we've talked about that Epic brings us, and that's Care Everywhere.
Care Everywhere.
So Care Everywhere is the function that allows us as an Epic user to see any other patient chart in any other Epic user or any other Epic hospital across the country.
Right.
So if our patient goes to, takes a vacation down to Florida and sees a physician in an Epic hospital, we're able to see that. To give you some numbers, we have had over 50,000 record exchanges between 150.
Just in 2 weeks.
In 2 weeks, 50,000 record exchanges with over 150 care organizations, hospitals, large providers that are Epic providers. In addition to that, we also have this function called Epic Care Link. Care Link allows non-Epic physician providers to get records for their patients from us. So they can actually log in, they can grab that record. We've had over 375 of those exchanges already. I mean, that's the power of Epic, right? I mean, that is really just a significant function that we've never had and makes healthcare more than just local to your hospital. It now makes it
portable,
community-wise, regional, national.
Yeah, for sure. Those are powerful stats. We appreciate it. We appreciate your team. Been right at the middle of all this from the beginning. And as we go forward over the next weeks, months, and then obviously as we light up the rest of the system at the latter part of this year, we'll talk some more about it. So thank you.
Thank you.
Thank you, Chris. All right, let's finish on two final topics. A workforce challenge. Every year we have the biggest team. We certainly hope to have the biggest team again this year. It's going to be May 16th. It'll be downtown near the plaza. And I think we're going to look for people to sign up for that, please. So look for that. And then in addition to that, we're encouraging our employees to use our gym. Our gym is open 24 hours a day. It's free. It's a wonderful gym. And there will be a table. I think there was one last week. There'll be one again in the future on the B2 bridge. So look for that. And we're encouraging our workforce to use that. Weather's great. Get outside, use the gym, all those things.
Amazing equipment in there.
And then the last thing is Match Day. So for those that don't know what Match Day is, every year in the college, we have our fourth-year medical students. They're going to be graduating in May. They are going to go on to the specialty of their choice. My case, emergency medicine, could be neurosurgery, could be obstetrics and gynecology, any specialty. They look to programs where they can get that next level of training. They rank them, the programs rank them, and then on one day, at the same time, all across the country, they find out where they're going. And that occurred last Friday, and you can look at some pictures here of the individuals receiving that news where they're going to go. It's always a special day. We love when the students stay here because the best stay here with us, and then we also love when they go other places because they can bring the Albany Med brand out there and represent the best of us out there. So we congratulate our students. We certainly congratulate the college. And match day is always a special day here.
It's great.
Yeah, it's
and
fun.
we heard it was the best match day that we've ever had.
Every year is the best,
Yeah.
but this was I think Dr. Bullo said the best, which is wonderful. So congratulations. All right, Chris, thanks for being here. We appreciate it.
Thanks for
always.
having
Yeah, we'll have you back again. And again, congratulations and thank you to your team for the great work they've done.
Thank you.
All right, we'll be back again in 2 weeks. We look forward to seeing you then. To those that are working here on Epic on the weekends, we appreciate you now more than ever. Take care of yourself. Take care of each other. We'll see you in 2 weeks.